Meanwhile, the Health Minister, Dr. Zweli Mkhize, says people need to prepare for a spike in coronavirus numbers in Gauteng, the Western Cape and the Eastern Cape. The Health Department says COVID-19 models predict that Gauteng will within the coming days emerge as the next epicenter of the disease in the country. Gauteng has recorded nearly 40,000 coronavirus cases, of which over 9,000 have recovered. To take the discussion further now, we have via Skype the Gauteng Health MEC, Dr. Bandile Masuku. Dr. Masuku, good afternoon. Thank you so much for coming through.
Good afternoon, and good afternoon to your viewers, and thanks for having us on your show.
Thank you so much indeed. Now, we had a guest on the show yesterday talking about the expected peak in numbers, and he was basically saying that the epidemic is largely affected by the prevention strategies that are implemented by the province. So if they don't work, the epidemic then takes off. What's your prevention strategy as the province?
Yeah, I think it's an important aspect that we need to discuss, and I think it's something that people tend to actually miss out in the discussion, because it has always been a situation when you deal with an infectious agent like this one, you really have to, in a greater extent, slow down the actual rate and disrupt the spread. And it has never been about preventing, actually the spread, as it were. But it was also all about us slowing down actually the rate of the infection. And what has been our strategy has always been preventative in a manner, in a way that we actually championed and actually campaigned and raised awareness about the golden rules, which relates to hygiene, meaning when you cough, when you greet, and also to keep your hands clean by washing hands and also by sanitizing. And also the issue of social distancing itself, it becomes a bigger issue, avoiding crowded places. And the issue of us conceding to the usage of face cloth mask by the public was also aimed at that level of preventing and disrupting the spread of the actual disease. So our strategy has always been about those two objectives of disrupting and slowing down, the rate. Because above all, it's important that we also have to deal with the pandemic at that level of those measures that we actually talked about. Mm-hmm. The second part of it is that, when we have identified the hotspots, it's then you are able to go in, trace the contacts, and be able to test them and also isolate or quarantine those who are actually affected. We have done quite well in that regard because of the hotspots that we have dealt with in the past 3 months.
All right, so from where you're sitting as the MEC responsible for the Department of Health in Gauteng, are you convinced that the strategy that you've been employing as the province is working? I mean, a lot of people are panicking now with the announcement that we are expecting to see a peak in the number of positive COVID-19 cases in Gauteng.
Yeah, I think I would have to indicate to you that the rise and the surge was expected because of a number of actual reasons. One of them is just the increased movement within the actual province when we moved from one level to another. And I think our strategy has evolved over time. It is not really the same strategy that we started with in March, what we are using, and it's also ever changing because the hotspots also change. They are not the same. And it's not the same way that we're going to respond to it. But the basic principles still remains that we trace, we track, we isolate, and actually quarantine those who are actually affected.
All right, so let's just go back to the issue you made mention of earlier, the hotspots. Talk to us about the approach that the province is currently using. Are you heavily focusing on the hotspots and contact tracing to prevent the spread of the virus?
We have been focusing on specific areas that have been found to be very much problematic. You will recall that at some point we were focusing all our energies at Ivory Park and also Tembisa. We also were at some point focusing on West Rand Hospital, particularly of the mining sector. And these are, like I've said to you, that these strategies, they ever change, they are actually ever improving. and they are not the same in everywhere we are going. And if you look at what we have done in those areas, you will realize that those are no longer actually hotspots in the main, and the hotspots also change as the pandemic actually grows.
Is the health system ready for any eventuality? We understand that the field hospitals are not fully equipped. I want you to touch on that a bit as to how fully equipped are the field hospitals, because we understand that more beds will be added onto those field hospitals. So talk to us about the capacity that you have at those field hospitals.
Our intention is to make sure that those who require critical care and intensive care will still be, by and large, be monitored and be nursed in our hospitals. And those patients who will be shifted or stepped down to field hospitals will be those who are particularly stabilized and who just require monitoring of their state. So field hospitals, they will actually acting like actually general hospital beds, but with the capacity to give a high flow oxygen in that regard. So it's the work that the field hospitals will do. It's just to act as step down. And we hope that we won't get to a point where we use the field hospitals as critical care actually beds.
But what about ICU beds that require ventilators, for example? Are they enough in the province? Because we also understand that there's a framework between yourselves as government and the private sector as well. Talk to us about that.
Yes, the ventilators might not be enough at the moment, but they're enough with the stage that we're in, with the beds that are available both in private and public. There is a standard MOU that we have signed with all the hospital groups. We also had formed a bed management team between all of us, where we're able to visualize the beds available in the province and manage them as they is. So the issue of ventilators is a process that is also handled by the National Department jointly with CSIR in terms of procuring more for these hospital beds that we're actually putting up. You would remember that over and above field hospitals, as the department in Gauteng, we've opted to build permanent wards in 4 various areas in our facilities to make sure that we have enough facilities and infrastructure beyond the pandemic.
All right, so as I said, there's so much sense of panic and anxiety amongst the people of Gauteng. What's your message to the people of Gauteng, MEC Masuku? More so we know that with level 3, life has literally gone back to normality. So what's your message to them? Is there a need to start panicking or do you have everything under control?
I think it's not an issue of us saying that people must panic, but people must be extra vigilant and careful and cautious, because their action will also help us to get our system into order, and it's also going to help us to save lives. So the blatant disregard of regulations is a big disappointing matter, which we have to address and also talk to our people. There's only little that as government and law enforcers can do. Much of it still remains that the public themselves must act in a manner that will be responsible, particularly in applying the golden rules, as I've actually described them before, of hygiene and social distancing. People should avoid as much possible crowded places as much as as they can.
So when we had you here on the show last week, you raised some concerns on the backlog when it comes to testing. How are things looking this week?
The tests have been processed completely, the ones that we spoke about last week in terms of backlog. We are getting the results as of this afternoon, and tomorrow when we report to the public, as we normally do in a daily report, we will be reflecting that the backlog has been completely actually covered, and we are now reporting on the actual tests that have been done in the space of being current.
Thank you so much for coming through. Gauteng Health MEC, Dr. Bandile Masuku, joining us now live via Skype. So as it is now, the latest numbers in Gauteng, we're sitting at 39,841 confirmed cases with 10,534 recoveries and 180 deaths. This, of course, is a developing story that we're keeping a very close eye on. Let's